Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Kenya back here with us today, and this is Kenya's first adjustment in 2016, right?
Yes, sir.
We saw Kenya a couple of times in 2015 before we left to go to St. Thomas, and he hasn't been adjusted since the 19th of October, actually.
Yeah, it's been a while.
So he's been having some lower back pain that's been going down into his legs and creating cramps in his hamstrings and even down into his calves. And that's coming from the pinched nerves out of his low back and pelvis, but also think he needs to drink some more water because dehydration can cause that as well. Let's take a look in the mirror at your posture here first, Kenya. And I'm going to have you close your eyes and flex your head forward and backwards for me. And then neutral. There we go. And he's got some translation forward into the side on the head up there. Can you see that in the mirror? Can you? Take a look. See how your head's a little forward and to the right?
Oh, yeah.
Your left shoulder's higher.
Mm-hmm.
Right hand looks longer than your left one. It's not really. It just looks that way because your head translated to the right. Pelvis is also shifted left to center line. It's closer over here than it is. You got more room here than you do over here. Okay, so let's lay you down on your back first, and I'm going to decompress you first.
Okay.
So this being Kenya's first adjustment since October, we should get a lot of good sound effects out of this one for all you crack addicts out there. We got a lot of crack addicts around the world that love hearing those popping noises. Okay, let's slide all the way up for me there, Kenya. It's where the pelvis is right underneath this pin. Yeah, it's going to feel tight. Okay. There we go. You're not going to get away now, huh?
I don't think so.
Whoa. It's better to be in there tight, though, than to be loose, because if these pins slide down the side of your pelvis, it really hurts.
Okay.
That's the worst part of it for me, too, is the pins. There we go. Perfect. Good job. Okay. Hey, we got another doctor in here now, so I got adjustments for him, too. There we go. Now, I want you to take a deep breath through your nose. Keep your teeth together and let all your air out. Oh, yeah. Baby. Home run on that one. That was the ring dinger. Felt that all the way down, did you?
Yeah.
Still kicking.
Oh.
Alright. Whew, baby. This is like an accordion, huh?
Yeah.
Okay, lay your head right in my hand on this one. Okay, let me have you tilt right just a little. That's better. Let go of it. That's it. Better. Okay. You feel a lot better when it quits hurting.
Okay. I'm going to trust you on that one.
That's my favorite line. It's always right. Alright, let's come over here on your tummy now. Make sure you get up sideways. You don't want to sit straight up. That'll cause your back to go out again pretty quick. Now I've got your head forward on purpose there. So.
Okay.
There, good. Right leg's coming up about 1/4 of an inch short, and it tightens up a little bit in your low back right there, doesn't it?
Yes, it does.
Yeah, see how his pelvis raised up off the table too. That's a sign that his sacroiliac joints are out. So I'm going to be adjusting those first. The right one here. And then I'm going to adjust the sacrum, which is the middle triangular shaped bone right in the center of the pelvis. And the left part of the sacrum, and then now the left sacroiliac joint. And we call that the SI joint. Sacro meaning sacrum, the middle triangular shaped bone, and then the ilium over here, so sacroiliac joint.
Okay.
And it runs at about a 45-degree slant right down through here. It's the largest joint in our body, other than the knee. It's really bigger than the knee joint. The knee joint's just more complex. But a lot of times people's leg pains and radiculopathies or pinched nerves down their legs is coming from their SI joints rather than just the herniated disc in the lumbar spine. So MRIs don't always pick that up. Now if they see, surgeon sees an MRI, it's got a bulged or herniated disc on there, degenerative disc even, they're wanting to do surgery on you. And that gives them a rationale for doing that. You don't ever hear them talking about the sacroiliac joints though, because there's really nothing they can do for those. There we go. So we get a lot of people in here that have already had back surgery 2, 3 times even, 4 times even, 5, and they still can't move. They started off at a 4 or 5 pain level, now they're at 10 plus all the time following surgery. So surgery is always the last resort, and the only time I recommend surgery for patients is when they're losing bladder or bowel function, or they literally cannot function throughout the day, like walking around kitchen or going to the bathroom, things like that. So you're far away from that. You have a few cramps in your legs watching the Texans play, but I think all of us cramped up on that game. They looked horrible.
That wasn't a good showing at all.
That wasn't a good showing, but we got the Super Bowl here in Houston next year.
Yeah.
That'll be fun.
Oh, sure will.
Houston will be live then. I remember when they had the Rockets playoffs here back in the day. That was the old days. 80s and 90s. There we go. That was when old Hakeem Olajuwon was playing for him. Now see, I'm just doing some lateral oblique stretching now. You should feel this from your pelvis all the way up into your upper back here where I'm touching. Yep. And after we get done adjusting Kenya today, we're going to send him over to get some 15 minutes of massage therapy by our new massage therapist, Joseph. You're going to enjoy that. Everybody today's been really happy about that. And we've expanded our services here to include increased myofascial release techniques, as well as have another chiropractor in here that basically is cloned. He adjusts just like me, so I don't want to call him a clone because he's got his own personality and his own technique, but at least he adjusts like me. There's only 1 of 3 chiropractors in the U.S. that I'll let touch me. Okay, let's go on your back.
Okay.
Unfortunately, the worst thing about chiropractic is other chiropractors. Let's go on your back.
Okay.
The ones that don't take to their art, learn proper biomechanics, and put you on your side and twist you and try to pop you and cause your back to go out even worse.
Yeah. I've heard some horror stories.
Yeah, everybody has.
Yeah.
We hear a lot of them here every day, actually. We take care of a lot of patients that come here as a result of watching these YouTube videos, and they've been to their chiropractor and go, well, my chiropractor didn't do 1/10 of what you did. Okay, let this all relax. There we go. Now, you should have felt that in your knee and your back.
Yeah.
Good.
Pop right in my little.
Yes, sir. And your knee, too.
Yeah.
There we go. Same on that one. Yep. Okay, let me help you up sideways. Kind of swing sideways towards your knee. There you go.
Okay.
Now, I'm going to adjust your shoulders and elbows and wrists. Got a little bit of kink right there in that shoulder. Did you feel that little skip jump there? There we go. Perfect. Yep. Right there. Good. Okay, I'll get your elbows and your wrists, and then I'll shoot you, and then I'll pass you off to Joseph. Can't get out here without me pulling your leg and shooting you. There we go.
And now pass me off to Joseph.
Yeah, now we'll get passed out to Joseph. That's good. But that'd be a great way for everybody to leave,
Yeah.
feeling all relaxed. There we go. Good. Okay, let's come over here in front of the mirror now. And I'm going to have you close your eyes again and flex your head forward and backwards and remember how that feels. Back to neutral. Yep. Okay, so see what you got going on there? See a little bit forward and to the right still. So your homework is you're going to pull up, pull back simultaneously, flare these guys away like that. Then we're going to bring your head straight back in the Z-axis and the left here. Now tilt left for me. Perfect. And shift your pelvis straight out to the right. Yep. Just like that. Lift your chin up. Feel a little tap there. Another little tap right there. Now, when you go forward and backwards this time, this should feel smoother to you, like we put some WD-40 on it. Try it and see. Straight forward, straight back. That should have felt smoother, did it?
Good.
Yep. Take a look in the mirror now. See here, you're not translated as much now. Your hands are more equal from side to side. You are right down the middle. Ready for a good massage therapy now. So congratulations on your first adjustment this year.
Okay.
And
thank
thanks
you.
for sharing that with the people on
No problem.
YouTube. And thank you
No
for
problem.
subscribing, watching, commenting, and sharing our YouTube videos. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.